If you're planning skin prep before a big event, maybe you're wondering about Botox before a wedding, or how long swelling after a filler may last, or what's the downtime for microneedling, and whether it's going to ruin a vacation or family photos. I see people making these timing mistakes all the time, and it really does cost them, and it costs a lot of stress and a lot of heartache when you show up to this big event and you've got some big bruise and some unsightly swelling. So here's exactly when to schedule everything to get it done right and get the most out of these treatments. Because if you do it the right way, it can be wonderful. If you do it the wrong way, you're gonna be sorry. Hi, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which means I help people look as young as they feel. And if you love videos on skin and anti-aging secrets and longevity, wellness tips, etc., make sure you subscribe to my channel. I upload a new video every week, and today I'm breaking down exactly when and what to do for your skin when you want to look your best for a big event. But make sure you wait till the end of this video, where I'm going to reveal the one thing you must do daily in order to make any of these treatments worthwhile. But until then, let's start an exercise. Picture an event that you have coming up that you want to look your best for. Now calculate how much time you have before that event. Having that number in mind is going to be good as you hear about these different treatments and try to put things into perspective. So without further ado, let's break it down. So let's start with maybe one of the most popular, if not the easiest treatments to plan for, and that is Botox. So Botox before weddings or big events are probably one of the most common requests that my practice gets. And I'm sure it's the same for practices all throughout the country. So here's the timeline. Botox doesn't work immediately. In fact, it takes about a week to 2 weeks to really start kicking in and having its full effect. And in some cases, it can take 3 to 4 weeks till you have the full effect of the Botox. And why that's important is because during that in-between period of time, 1 week, 2 weeks, etc., you might have a portion of your forehead that's working better than the other. You might have, part of the brow that's a little higher than lower. It takes time for all of this to kick in, and then finally when it does, you have your final results. I would always tell patients it takes about a minimum of 4 weeks to really get that full result with it, and anything short of that, because there's variability between people, makes it a little bit unpredictable. Definitely don't go in thinking you're gonna get Botox like a week before an event and be able to pull that off safely, because not only will you probably not get the full effect of the Botox, which would be unfortunate if you're expecting to smooth out the lines and wrinkles, but also you're going to show up with probably these kind of in-between phases, which isn't really a great time. It's better probably not to have any Botox in place than to have asymmetries or slight drooping or something unusual. In addition to giving yourself a little bit more of that time, it does afford you an opportunity. Sometimes if you see something very glaring happening at 2 weeks and you have to sort it out, let's say not enough in the top of the forehead or too much above the forehead and not enough here, well then you have an opportunity to do like little micro drops of Botox, just a few units here and there to even things out by that 4-week mark. So I really like to plan ahead and make sure that you have enough time to deal with these stipulations and sort of unpredictable events. So in addition to that, there's also the reality that you might bruise from Botox. So if you're doing it like a week or so ahead of the procedure, you might be sorry if you end up with a bruise and you have to show up with, a black eye or whatever it is. So keep that all in mind as well. Putting all that into perspective, another really important point here is that Botox does last 3 to 4 months. So maybe the peak of its effect is even 4 to 6 weeks. So if you have the time and you're able to plan ahead, give yourself as big of a window as possible, but don't give yourself a full 4 months ahead of the event and then show up to the event with all the Botox completely worn out, and then you're wondering why are you not having the effect and you just did Botox. Know that you're going to get about 3 to 4 months out of it, and plan for the sweet spot to be somewhere around 4 to 6 weeks after the Botox injection. These timing points are really, really important. A couple other things that will help you with Botox success. Number one, you don't want to work out afterwards. And some people even say you don't want to work out too much ahead of it, but really it's afterwards that's so important. you don't want to lay down. And the reason for this is sometimes the Botox can actually migrate out of the area that it was injected. And if you're injecting in the glabellar region, which is around the eyes, if it migrates down, and sometimes people have anatomic clefts and things like that that allow Botox to actually migrate down. And if it does happen to you, you're going to end up with a droopy eyelid. And term for that is basically ptosis, which is a terrible look because your eyes are basically at half mast and you can't completely open it. You just look tired and oftentimes asymmetric, and it's a very, very bad look. And if that happens and it peaks right around the time when you're having an event, oh, it's going to be a disaster. So again, earlier, better, because that usually starts to wear off. And so by the time you show up at your event, you'll be fine. But you really want to do these other aspects ahead of time to keep that from occurring. In addition to, of course, always make sure you're getting stuff like this done with an experienced Botox injector and not somebody who's just getting started and you take your chances right before a wedding. The other really important thing is you don't need to, knock out every single line and wrinkle. I'm a big fan of just leaving some movement, but just taking the oomph out of the muscles. And that's the way, I think it looks the most natural and it also the most youthful. But when you can't move at all, that just doesn't look right. It doesn't look normal. So, advise your injector that they don't need to go for the knockouts. They just need to, sort of take the oomph out of these muscles and keep you from looking frozen. So if you do all these things, Botox can be very predictable, and you could be very happy with the outcome. I love the effect of Botox before events because I just think no matter how good you look a little bit better with the right Botox combination. And remember, it is an art and it's not just science. So the injector really matters here. All right, so let's talk about filler, which is not as predictable as Botox. So here's the deal. A lot of people, as they get closer to holidays and family vacations or big events, they want to look their best naturally. And part of looking your best often means getting rid of some of those areas of hollowness and sort of tired deflation, right? It makes sense. Where are the common areas that people inject filler? Usually it's under the eyes or the cheeks. The cheeks get a little bit deflated. The lips are another big area for people to kind of add a little bit of volume back into. But here's the deal. When it comes to filler, there's a couple things that you need to keep in mind. Number one, fillers have a higher chance of bruising because you're going back and forth and you're going much deeper than you are with Botox. Second of all, there is also a higher chance of swelling. So you got bruising and you got swelling, and bruising adds to swelling, and swelling in of itself is just part of the injection process as well as the placement. And swelling isn't always symmetric, and swelling isn't always quick to come down, again, depending on how much you inject. So you can actually expect 2 to 3 weeks sometimes for the swelling to fully resolve. And sometimes it can take a little bit longer. So the thing is, if you're injecting, say, your lips, or you're injecting, a part of your face that's very noticeable, like the cheeks, etc., and you've got this asymmetric swelling, you're going to be disheartened as you get closer and closer to your event. So make sure when it comes to filler, there's a couple things that you definitely want to do. Number one, you'd never want to go in for filler, and this is probably the same is true for Botox, where you're taking anything that can thin your blood. So things like aspirin, Motrin, even things like garlic and ginseng and ginger, turmeric, a lot of these things can thin your blood. And you don't even realize it. Fish oils actually and flaxseed oils, these things can thin your blood. So you go in, you get a filler done, and you're on these things, your blood's thinner, it doesn't clot as easily, you get a nasty bruise. Now you're dealing with a bruise, and sometimes the bruises can take a while. In addition to the fact that you want to stop all those things, you also probably want to get on arnica. Arnica and bromelain are good anti-inflammatories that help with bruising. And if you don't want to take arnica, which I think you probably should, especially if you got something important going on, bromelain can also be found in pineapples, and eating some pineapple ahead of the procedures is really important, and afterwards. But a lot of practices have these little arnica and bromelain tablets. Go ahead and get on them, or not order from the internet and Amazon or go to your health food store and get it, because that can really help speed up the process. And if you do happen to bruise, there are lasers that can help with bruising, pulsed dye lasers, BBL, etc. They can be done to mitigate and speed it up, but you want to get to your injector early so they can see what's going on, and they can then hit you with the laser and speed up the process. But the moral of the story here is definitely give yourself plenty of time before an event to get a filler. I mean, honestly, the more time, the better, because these fillers are lasting like 6 months, 9 months, a year. So there's no reason why you should do it just before. If you have the opportunity, 6 weeks, 8 weeks is a good amount of time just to be safe. Again, if you want to roll the dice and take your chances, obviously you can do it sooner, but now you know the timeline. If it were me, I would plan this stuff a month or 2 or 3 even in advance if I knew that I had something really important going on. But remember, at the end of the day, a little bit of filler here and there, especially if you're doing it in a very subtle way, can be a nice little boost, both to your appearance and your confidence and sense and all this kind of stuff. So I'm not opposed to it. Just plan ahead and be mindful of some of these issues and the time it takes to actually settle into place. Let's talk about the pre-wedding HydraFacials or facials. So HydraFacials are a great procedure. HydraFacial is basically, it's not like a typical facial, but it's a device that gives you a little bit of a very superficial acid chemical peel, and it sucks, think of it as like a shop vac that literally pulls the stuff out of your pores, so it kind of decongests and cleans your pores, which a lot of facials, do that in different ways. But this does it with a device, and then finally it adds serums and things like that to plump your skin and make it look really, really great. Now, these are safe bets for last minute prep for skin before big events. And the reason is essentially they have zero downtime, but there is a period of time that it takes to really get the most out of it. I usually recommend a day or 2 or 3, probably 3 days, 2 days is good, because there is sometimes a little bit of redness from the chemical peel aspect of it. So the next day is probably not the best day. The second or third day is probably when your skin actually looks its best. So third day before is the sweet spot. And at the end of the day, honestly, it's a great procedure. My wife, I don't know how often she does it nowadays. I think she still does it pretty regularly, but really before a big event, etc., it's a lovely way just to kind of like get that suppleness and that brightness back to the skin. And it's a simple way. It's a hydration aspect of things. So you're good to do that as early as you want with no real fear of creating new problems with it. Now, here's sort of the caveat with this. You're also not going to get some dramatic improvement in your skin when it comes to discoloration or fine lines and wrinkles, but definitely there is a glow that comes from this treatment. And I think that's really comes from the hydration aspect of things and the light chemical peel, which is a great thing to do. And another really important thing while we're on the topic of HydraFacials to keep in mind is it's a great adjunct for long-term skin management. It's not a must-have. It's a nice have, but it's not a must-have, meaning that it's not going to replace what's really at the core of skin anti-aging. Like, this isn't going to keep your skin from aging, but it's a nice treatment in general to add on top of it if you've got the means to do it, you got the time to do it. But the key to keeping your skin actually looking young in the long run comes down to daily active skincare, consistent use of retinols, vitamin C's, etc., which we'll talk about a little bit more. But again, wonderful, wonderful treatment for that pre-event glow. All right, so now let's change gears and talk a little bit about microneedling and microneedling downtime. There's a lot of confusion about this. So people see these dramatic before and afters online about that redness, the inflamed skin, and think, geez, I can't do that before an event. But in reality, standard microneedling, which means that it doesn't involve radio frequency or doesn't involve heat, it's just the basically like a dermapen that you perform in the estheticians practice, plastic surgeons, etc. Usually this is done by an esthetician. Lovely treatment. Very little downtime. Even if you do it with PRP, you might even see a faster recovery actually, but you're looking at like a day or 2 of redness. And that probably counts for even very shallow radio frequency microneedling, although that's a little bit more unpredictable. So just a standard microneedling, you're looking at a day or 2 to do it. So that's something that you're not going to get a big improvement in any way. This is more of like a long-term treatment. So if you're kind of thinking to yourself, oh, I want to go get ready for this event, I'm going to go have microneedling done. I haven't seen, that much of a dramatic uptick in appearance using a microneedling right before an event. But definitely it's a good long-term strategy. My wife does microneedling on her neck, for example, every 6 weeks to keep the neck skin in good shape. Other than having that little bit of redness for the first day or so, I don't see much in terms of persistent redness. But If you're gonna go get like a radio frequency microneedling, which honestly, I'm not a fan of when you go deep, like the 4 to 6 millimeter versions. There's all sorts of risks associated with that and a lot more downtime associated with that. And literally the risk of melting fat, damaging the skin, the subcutaneous fat, all those things become potential risks. In fact, recently the FDA presented a warning about this, effectively warning people that deeper approaches with RF microneedling can really create some unwanted effects. So that's another topic, obviously, but in general, the ones with energy you want to certainly avoid before an event, especially within a few weeks of it, because it can take a bit more time. But standard microneedling, less than 1 millimeter deep, totally fine to do, but don't expect a ton from it. At the end of the day, microneedling fits into more of a long-term, consistent strategy to stimulate collagen than it does to transform the skin. I think you're going to get a better result with a HydraFacial right before an event than you are going to get it with microneedling. But overall, I love microneedling for that reason. All right, so now let's switch gears to chemical peels, which are similar in principle, but the timing is way more variable and the results are much more dramatic in a positive way. So chemical peel timing depends entirely on one thing, and that is how deep the peel is going. So as you remember from previous videos, there's a superficial peel, which is kind of also called a light peel, medium depth peel, and a deep peel. The light peels is just about the concentration of the peeling agent. It's really, you can do it probably about a week or so before the event. You're gonna start to get some flaking and a little bit of healing and redness and things like that, but usually by a week, 10 days, it's gone and you have this nice glowing skin. There's a refresh because that stratum corneum, which is the top layer of the skin that is often the dullest part of the skin, that comes off and you get this nice kind of brightness. I always think of it as like peeling the top layers of an onion, you get that glistening layer below. Now, these are things like, glycolic acid peels, Jesner's peels, etc. These are all kind of like regular peels that are done in esthetician practices and things like that. And I think they are great to do, but I would probably even suggest doing it a couple weeks ahead of an event. Now, the other depth that is much more hardcore when it comes to healing is the medium depth peels. Now, these are like 35% TCA or 25% TCA. They can take up to 3 to 4 weeks for things to get better. But they're very, very effective. So if you have discoloration, you have fine lines and wrinkles, this is a great way to make a big impact on your skin and get a really bright, fresh looking skin, but make sure you plan ahead. And if you have like darker skin type, like me, for example, or even lighter than me, olive tones, you want to make sure you pre-treat with the medium depth peels. You don't really need to pre-treat with the lighter peels, but you definitely need to pre-treat with the medium depth because you could actually get hyperpigmentation from these peeling agents. So be aware of that aspect. And the things that you use to pre-treat are going to be things like hydroquinone. If you want to get a prescription, use the Karam MD trifecta, which has all the lightening in there, or you're going to get on a retinol or retin-A plus a hydroquinone. They can help decrease the risk of hyperpigmentation after these. Now, deep chemical peels, forget about it. This is a completely different story. This is more like having a surgery downtime. This is really going to take a long time to heal and recover from. Very, very few people perform deep chemical peels these days. They are phenomenal in terms of how they can look, but it's a real art and a science. And this is definitely not something that I would do anything earlier than at least a few months ahead of time, and 100% make sure for both the medium and deeper peels, you're in the hands of somebody who actually knows what they're doing. This is not something that you want to just go to anyone for. You will literally destroy your skin and run some serious risks associated with it because putting it on too long, putting on too much, layering it on too much, all these things can literally burn through your skin. I mean, it's a nightmare. So being able to read the peel is a huge art and something that comes with experience. So be aware of that aspect of it. So in chemical peel summary terms, let's just think a light peel, 1 to 2 weeks, medium depth peel, 3 to 4 weeks. And really, if it's the first time you're doing it and you don't know if you have melasma or any of these other skin conditions, definitely give yourself a few months ahead of time. All right, so let's move on to the next section, which is, sort of the last minute rescue plan. Let's say your event is in 2 weeks. You've done nothing. you're panicking. What now? Here's your safe zone. Your last minute skin prep, skip the filler, too much swelling risk. Keep microneedling, that's fine if you want to get a little bit of a boost of going on in terms of that. Maybe even just a little bit of swelling in the skin makes the skin look more supple, but not enough time for really collagen to build up. So I would skip chemical peels. That's a little bit risky, although you could probably get a very light one, especially if you have one before and you know what to expect. Definitely skip lasers. Lasers can be very variable in terms of its recovery. But the HydraFacial is perfect. So gentle, 2 or 3 days before your event, you get a nice little glow boost, you're good to go. Botox, maybe, especially if you've done it before, you kind of know what to expect. I wouldn't do this as a first-time treatment. You probably would, you'll panic a little bit. Now, at-home skincare, exfoliation at home, the polish, for example, which is part of our Karam MD line. It's an enzymatic exfoliant, amazing way to just kind of get your skin brightened and fresh before events and just ongoing, of course. Even the components in the trifecta, like for example, hyaluronic acid and the lipids and all these things, these work immediately. So there's a brightening effect that happens to the skin. If you're not using the Karam MD trifecta, you look for a good high quality hyaluronic acid product. That'll give you a little bit of suppleness and improve. But the reality is, if you have the time, you want to get going on these type of things consistently, because month over month, your skin's going to get better when you're on the trifecta. So this is not something that you're going to get immediate improvement, but at the end of the day, good long-term sort of planning there. But even if you don't get a chance to get in for a HydraFacial, you don't know somebody to go into your esthetician and get a regular facial and let them know you had an event. They'll do some things to kind of boost up your skin and make things look a little bit better. But ultimately, that's kind of like your safe zone to prepare for an event. And you're not giving yourself a lot of time, but at the end of the day, these safe things are better to do than kind of risk a treatment. And I can't tell you how many times I've literally said no to patients coming in for bigger treatments before events that were like 2 weeks away. So an interesting kind of a side story, there was a patient who recently got married and hadn't had any major in-office treatments before and didn't want to risk any adverse events, and she was less than 6 weeks out. So we completely skipped all those kind of in-office treatments and went 100% at-home skincare. We got her started on the trifecta and got her religiously using it twice a day, every day up until the wedding, and of course after. And also got her on the polish, the enzymatic exfoliator. But we also added Enrich, which is a nighttime slugging agent, which basically think of it as retaining overnight fluid loss, water loss, and also bringing in a lot of important anti-aging ingredients in there. And really, in 6 weeks, her skin looked noticeably brighter, more supple, and just all around, free of lines, a lot better in terms of lines, not completely, but it was just, it was the beginning of a very, very good trend, and she was very happy. So the point is, there's no magic last minute treatment that'll transform your skin in just a couple weeks. Skin improvement takes time and consistency, which really brings me to what actually matters more than any treatment. And here's what I want you all to understand about skin prep before big events. The best event skin doesn't come from treatment you do 2 weeks before. It comes from what you do every single day for 3 months, 6 months, a year, 2 years ahead. This is very important to understand. It's that daily focus on sun protection, active skincare, and also diet and exercise. The treatments that we just talked about, all those things are really just boot camps. They are enhancements. They move the skin in the right direction. They accelerate the changes, but they don't last. And they don't change the foundation. But daily cleansing, daily use of vitamin C for brightness, sun protection, retinols for collagen support and development, fine lines and wrinkles, hyaluronic acid for bringing in water into the skin and bringing that hydration back and balancing the lipid levels so pores get smaller, etc. All of those things are what really transform the skins and keeps the skin from actually aging, in addition to actually rejuvenating the skin. Because remember, these actives are working at the cellular level. They are changing the expression of the genes. They are making a cell that no longer wants to make collagen and elastin start to produce collagen and elastin, and therefore building youthful skin again. So that's really at the end of the day why I developed the trifecta the way it was. I wanted it to be extremely simple to be used so that you can use it every day and there would be no excuses, and that the results come from the fact that there's nothing but real ingredients in there that can actually transform the skin. So keep all of that in mind, that all of this stuff is your foundation, and then you've got these other things that can kind of help you along the way. And Botox is a great treatment that helps with the consequence of aging skin, but if you focus on actually rejuvenating skin at the base layer, Botox doesn't become as necessary. Remember what 20, 30-year-old skin looks like? It moves, but it doesn't crease. And that's because the skin is actually thicker and more supple. And that's really what you want to do. You want to get back to that level. And you can, doing all the things that we talked about and what we share in a lot of these videos. And here's an added benefit and a huge bonus on all this stuff. When you start doing these things on a consistent basis, treating your skin the way I'm discussing, getting on trifecta, etc., all this kind of stuff, what you're going to see is that as time goes on, you stop needing a lot of this stuff. Now, I always think there's going to be a place for Botox. Again, even Netta, who's got lovely, beautiful skin and has been, managing it since her 20s, when she gets a little bit of Botox, her skin looks better. Just her expressions, everything looks softer and better, looks less tired, I should say. But she never does lasers. She never does chemical peels. She does microneedling on her neck only. And that's because she has genetically kind of thin neck skin, so she's trying to be preventative with it. But when you start doing this stuff, you stop needing the other treatments, even before big events. And that's really, at the end of the day, the power of treating the foundation, that it gets better with time, and ultimately that's the greatest freedom you can have. Now, there is one sort of fundamental aspect that goes along with all of this, and even with like the most perfect timing and the best treatments and the most active daily skincare and the best diet and exercise and all that other stuff, there's one thing that can ruin it all, and that is sun exposure after treatments. So this is where people undo everything. So you go get a chemical peel, then you go sit down on the pool for a vacation. What happens? Your skin hyperpigments. So fresh filler, hot yoga class, swelling potential migration, all these things, right? Microneedling, then a beach day without SPF. You reverse all the collagen benefits and risk hyperpigmentation. Treatments make your skin vulnerable, period. So you have to be aware of the need to use SPF, a good broad spectrum sunblock, which is basically the physical sunblocks that I generally recommend, the ones with zincite, titanium oxide in them. Use hats, use shade, reapply. All of these things are super important, because if you're doing all these other things, you're spending time and money on these type of treatments, last thing you want to do is do the one thing that's undoing it all, that's accelerating the skin aging process, right? So make sure you recognize the importance of all this. This is, in my opinion, a non-negotiable. So let's put it all together. Here's your complete skin prep before big event timeline. So 6 months out or more, you start your daily skincare foundation, right? Use the trifecta, get it going morning and night, and don't skip a day. Use it prescriptively. This is what's building your skin, making it look better and better month over month. 3 months out, if you're then interested in doing lasers, this is a good time that you can do them. Give yourself a maximum healing period before laser. So what lasers would you do here? If you've got discoloration like dark spots, you might do an IPL or a BBL. If you've got some fine lines and wrinkles, you could do like a micro laser peel using erbium YAG. Those are things that you can do, and you'll have plenty of time to heal. 8 to 10 weeks out, first time doing filler, this is a good time to give it a try, because you need to see how you're going to respond to the swelling and potentially bruising, but that'll give you enough time for everything to hopefully settle into place. And even if you got a little bit more time, I'd even go to 12 weeks, but 8 to 10 weeks is a good number to look at, and it'll look fresh before the event. Medium depth chemical peels. This is also a great time to consider this. Plenty of time to heal from the treatments, and ultimately your skin's going to look actually amazing right before the event if you plan ahead. But keep in mind, there's no need to do medium depth chemical peels if you're not trying to really address any major skin concerns like heavy exfoliation needs because your skin's super dull or discolored or maybe fine lines and wrinkles. But if it is, whether you're using a chemical peel or whether you're using a laser for this, this is a great time to do it. Let's say you're down to 6 to 8 weeks out. Microneedling is good, and it's not a game changer, but it's a fine time to consider doing this. And if you have experience with filler, this is a good window to do it, right? We said if you don't use filler, give yourself a bit more time. But if you have experience with filler and you see what it looks like and you have a good injector, 6 weeks or so is a decent time to do it. Now you're 4 weeks out, right? So you've got your skin in good shape, you got your volume back into place. Now you just want those little fine lines and wrinkles and the expressions, and you want to look fresh before the event. Botox, perfect time to hit it up with a little bit of Botox 4 weeks ahead. Now you get a little bit closer, you're 1 to 2 weeks out. This is another good time to hit yourself up with a light chemical peel. But if you did a deeper chemical peel or if you did a laser, there's no need for this step. Now, no matter what you have done prior to this point, 2 to 3 days out, go get yourself a nice gentle HydraFacial. This will just boost up your skin, make things look a little bit brighter and glow, and that hydration goes a long way. Now, what do you do the day of? Nothing. You just show up. You've got yourself some beautiful process along the way. It kept you from getting into any pitfalls and new stresses right before an important event, and you're in good shape. So just go out and enjoy it at that point. So that's the roadmap, my friends. Follow it, protect your skin from the sun, stay consistent with your daily skincare, and you'll look like the best version of yourself. And this is really good advice to use no matter what. And a lot of this stuff can be applied whether or not you have a big event or not. All right, so that's a lot of information, but I think it's a lot of good information that could really, really keep you out of trouble. And I hope you enjoyed this. I hope you share this with some friends and family. And if you enjoyed this, make sure you hit like and subscribe to the channel for more information like this. And if you have any questions or comments about this approach, I'd love to hear them in the comment section and what you personally like to do to prepare for big events. And if there's anything we can learn from you, please share them along. And if you're ready to take even deeper dive into skin treatment, timing for holidays and other big events, make sure you check out the article in Karam MD Journal, which is linked below. And that is a free newsletter that comes out every single week. So make sure you check it out. It comes to your inbox. You don't want to miss that. And until next time, folks, Dr. Amir Karam.